There is no woman who can become a father. There is no woman who can turn a son into a man, because you cannot give what you don't have.
Hello good people, Susie Ledadem, living positively regardless. Doesn't matter the point at which you are in life, but you rock positivity all the way. Thank you so much for you my people, for your support. You have given me so much support. Welcome to the new subscribers. If you're new here, karibu sana, and just know that this is a place of positive energy only. Not that we don't have challenges in life, we do have them, but we rock positivity in any form of situation, because even looking negativity will not solve the problem. So why bother add a problem on top of another problem? And now if you're not going through any serious issue in your life, why then not enjoy the positive energy? So guys, today when you see me smiling, you always know I smile when I have a guest in the house, and I'm so excited. So I will not take too much of your time. I'll let you know who is the guest of the house, then I'll tell you what it is about today's show and where we are today. So before then, hi Daktari.
Hello Susan.
Karibu sana.
Asante sana.
To Susie Yule Diadem.
Thank you so much for having me.
Yes. I just want you to look at the camera. Maybe just to let our viewers know who you are.
Yes. So good morning viewers. My name is Dr. Beatrice Maingi. I am a mental health advocate, a mental health enthusiast. I am a psychologist by profession. I have worked in this field for the last 25 years, just managing issues of mental health, but specifically interested in the issues of addiction. So I run a mental health facility where we admit both males and females who are struggling with issues of addiction and also mental illness, especially mental illness that is not very profound. And that is why we work with psychiatrists and other professionals so that we can manage people who have issues of mental health, and especially substance-induced mental illness. So I've been doing this work for the last 25 years. And I also serve in the Kenya Board of Mental Health, in charge of standards and regulations. And this is where we set up the standards of establishing mental health facilities and services in the country, just to ensure that the issues of stigma are handled, and also to ensure that there is access and affordability of mental health issues in the country, and also ensuring standardization so that the quality of mental health services that are being offered in the country are uniform. I also serve in the End Malaria Council with the understanding that some of the measures that have been put in place to fight malaria may be compromised when the behavior of the people stands in the way. And so I am in the committee that deals with the social behavior change and communication, so that we can break the stigma around malaria, and also break some of the social and cultural issues and cultural beliefs that may stand in the way of offering good services in this area. So generally, I'm also a researcher in the issues of mental health, and also an author in issues of mental health. So my 8 to 5 job is working in this facility that is called Nobility House Treatment and Rehabilitation Center, just working with people who have issues of addiction and mental health.
Ah, beautiful. So guys, now you are well informed why we are here and what we are handling. Let me tell you, the new subscribers, the first video I did at Susie Ledadem, if you're able to go back and see, I said that I think people are sick, because I was referring to them the statistic, or rather what we had been given on our, not social media, but on our media houses, and there was so much that was reported about homes, issues that are happening at home. The wife has killed the husband has killed the wife, the husband has killed the children. And I said, my first video, I said, I think people are sick mentally. And now today, that is the same message. We are here to check, and now I want to check with the profession so that I realize whether my statement was correct or it was not correct. Because Daktari, I was just watching the TV and I was wondering, why is it that every day we are hearing people who are supposed to be loving each other, because the reason they are sharing a house as a husband and a wife is the love. Then all of a sudden one has killed the other. And the thought I had is like, I think people are sick. Why would you kill the same person that you love? But I don't want to start from there. Let's start by knowing, Daktari, how did you come to choose your profession? What is your background so that you came to be interested with doing psychology?
Okay, so thank you. My background is teaching. I started as a high school teacher, and I taught for about 10 years. Then when I was in school, there's something that kept catching my attention. Teachers who were struggling with the issues of mental illness, and especially teachers who had addiction, because we have a big percentage of teachers who have issues of addiction. And I could see the kind of effect that this was having on the learners. And, considering that students are in the formative years, and the people that are in charge of them have issues of addiction. So it disturbed me a lot to wonder what kind of impact this is going to have on the young minds. And so I got interested in pursuing a master's in psychology. And my research was on mental health of teachers, and also the connection between mental illness and substance abuse among teachers. And so when I did my psychology, that is actually what attracted me, to see what is it that is disturbing these teachers, and what can be done to help them. Because I realized that most of them would come for discipline issues, and some of them would end up losing their jobs. And to me, I felt that this is not a solution, because the impact has already been done. And I felt that once you help the teachers, then you'll have helped the young people. And I thought I would be interested to work in the area of mental health among teachers. So I pursued my degree in psychology. And then after that, I was deployed to the Teacher Service Commission. And especially, I think what attracted this deployment was my research in mental health among teachers. And so I was deployed to the Teacher Service Commission at the headquarters, in charge of management of teachers. And I was in charge of the wellness section, where we were dealing with teachers who have mental illness, teachers who had issues of substance use disorders, mental illness, HIV and AIDS. And as I worked in the Teacher Service Commission, I also got interested to dig deeper and find out, because we did a research just to find out how many teachers are abusing alcohol and drugs in the country. And the percentage was startling. Those who answered yes to the question, do you take alcohol? The statistics were startling. And so I said it is important now as a psychologist to go a step further and find out how many then are addicted. And that is what now informed my PhD thesis, my doctorate. I still did a PhD in the mental health of teachers. And so I did now to find out how many are addicted. And after that, I continued working with the Teacher Service Commission. But at some point, I felt that I needed to expand my horizon and deal with not only teachers, but the bigger population of people who have substance use disorders. And that is how now I left my job at Teacher Service Commission to come and establish this facility, Nobility House Treatment and Rehabilitation Center. So here we admit all manner of professionals, because the common denominator is addiction, how it affects people, and what we can do to help them.
Okay.
Yeah.
Wow, I feel like you have gone so deep in matters addiction. And Daktari, I hope you will be kind enough to host us, to have us again,
Yes.
so that we can discuss now about addiction, drug
Yes.
abuse, and all that.
Yes,
But
yes.
for today, I still believe, I want to believe, 25 years of practice is long.
Yes.
I want to believe you have dealt with issues, family issues like
Yes.
parenthood and all that. Have you?
Yes, yes.
Okay.
Yeah.
So we can just get into it.
Yes.
Because today's guys, what I want us to discuss today, and I believe we have the best in the house, I want us to talk of the issues that are surrounding marriage and family as a whole, and how is it affecting children, because we are seeing so many things that are happening between parents who we may say they are adults, but now in that whole family there are children in the picture. So maybe, Doctor, we could start by understanding some of the roles that parents play in a family.
So parents, they play different roles. The mother has the role of nurturing and taking care of the basic needs of the children. The father also has his role as the protector, the defender, the one who provides security, the one who provides the affirmation and the assurance to give children a good, background or a good grounding. And the father is actually the one who prepares children for future, by assuring them of his protection, also providing security, providing, the presence of a father actually makes the children feel we are protected, we are secure, we can face any challenge that comes to us because we have someone to fall back on. So the mother and the father have different roles. The mother, the nurturing, the protection, the reassurance, the presence. The father, the masculinity, the protection, the security, the assurance of even future protection, and the provision of basic needs. Yeah. Yes.
Wow. In this family setup, do you think there are issues that you'd say this is a toxic environment for a child to grow in, or this is a healthy environment? How would you differentiate the two if there are such?
Yes. Thank you for that question, and it is a very, very important question, especially for the times that we are living in. And this answer will be informed by what I've experienced in my work here at the rehabilitation center, because I came to realize that a big percentage of the people that we are dealing with, their problems have been caused by their background, their upbringing, what we call the adverse childhood experiences. And what we find is that there are some environments that are toxic for children to grow up in. And these environments, they inform the future of this child, the kind of relationship that they will form in future, the kind of person that they become. So even issues of addiction have a lot to do with the upbringing of a child. What are some of these toxic environments? One, when there is violence in the family, because there are times when parents may fight, in front of the children, and so the children feel insecure. And some of this violence is directed at the children themselves. And so they grow up in an environment where there is insecurity, where there is uncertainty. When a parent is abusing substances, the environment becomes uncertain. One day the parent is happy, the following day he's fighting, the following day is chasing the children out of the house, So the environment is very uncertain. And of course, when a parent is abusing substances, there'll be issues of, lack of basic needs, because addiction is a very expensive undertaking. And so the parent may not be able to provide some of the basic needs. So when a father or a mother is absent, absent fathers, absent mothers. Sometimes the mothers would be very busy, maybe in their businesses or pursuing even education and other things. And so the children feel unsafe. They feel like a hedge has been removed. They feel like they are not safe because the parent is not there. The father may also be an absent father. This is a toxic environment, because children will be left maybe in the hands of the caregivers, and they feel like this person who is supposed to give us protection is not here. Is not here. So there are other issues like even abuse, when maybe the father would be abusing the mother in front of the children. This is also toxic when there is lack of basic needs, when there is lack of safety, All these are toxic environments. Even when a child is growing up in an area that is unsafe, because maybe the parents cannot afford to put them in a safe place. We have estates where there is a lot of insecurity. Every morning there are gunshots, there are people fighting and all that. These are some of the toxic environments that inform the kind of person that this person becomes in future. Yes.
Wow. That is on the side of the toxic.
Yes.
So I'm imagining when we flip the coin, if there is no abuse,
Yes.
if people are friendly in the house, then that's what we would call a healthy environment for this child to grow in.
Yes.
Now, trying to understand this child in this family, at what age all do you think children, because sometimes they are that which is so outspoken, like when people are fighting and maybe the wife is screaming and all that, but there are other things where maybe there is just a cold war in the house. How is the mentor of the child in the house? How are they able to capture things when they are happening, and how does it affect them?
Okay. Okay, there are those things that will be glaring, like the physical fights, you're saying. Even when parents are having that silent war, children will still see, they still feel the tension. And for your information, even an unborn child during pregnancy, when the atmosphere is unsafe, when the atmosphere is hostile, the child still senses. So if you are talking about the age at which a child would be able to tell that this environment is not safe, we are saying from womb, from the time that they are in the womb. If the parents are fighting, and if there is insecurity, there are fights, there the child will sense. And that is why even when we are assessing people who have issues of mental illness and substance abuse, we go back to the pregnancy. How was the pregnancy? How was the atmosphere when you were expecting this child? Was this a wanted child, or was it what people call accident? We know it's not an accident. Of course, when a child is unwanted, there will be maltreatment. Maybe a mother has gotten pregnant when they had already decided we don't want another baby. So the father will be hostile, there will be abuse. That child will already sense that hostility. And if an intervention does not happen and someone becomes aware that this child needs to be supported, they may develop issues of low self-esteem as they grow. So the age at which we need to really take care of the child, from 0 to around 7 years, because that is when the brain is very receptive, the formative years, Although now when we talk about advanced childhood experiences, even up to the age of 17, those things that happen up to that age will still affect the child. That the most fundamental age would be from age 1, from 0 to around 7 years.
Wow. So you're saying from the time of conception, you should be very careful how you're treating your children. Because your brain is able to capture all these all the way. And it affects them even later in life. Now, what do we do now to these children who are already exposed to this environment? Because you're calling it mental health. And if I pick the word health, if someone today is maybe having a health issue, let's say they are suffering from malaria or something, they can go to the hospital and they get medication. Now, this child who we are observing and we are realizing they are exposed to this. How are we able to help them?
Okay, so what we are doing, and this is something that most of the mental health practitioners are now aware, is that when we do an intervention, our interventions must be trauma informed. And what do I mean by this? That when we have people who have mental illness, it is very important that you also assess for what we call adverse childhood experiences. Because there are times when we may handle issues of mental illness or addiction, and we deal with issues of maybe the underlying conditions like depression, anxiety, and other underlying conditions. But if we miss out on the effect of the adverse childhood experiences, then there is a possibility that that problem will bounce back. And so that's why we say from the onset, even as we look at other issues that may have caused the addiction, you must also assess about the upbringing of this person, so that you also deal with the trauma that may have been caused by the childhood experiences. Because we say that if you miss that, that is one of the areas that may bring someone back into rehabilitation program.
Okay.
Yes.
When a child is growing up, are you able to pick something like you can tell this child is disturbed mentally?
Yes, and like I mentioned that I'm in the board of mental health, and one of the things we are doing is also developing mental health programs for schools, so that even teachers and other handlers of young children are able to pick some of these issues early enough. Because you will see maybe a child who was very happy, very outgoing, suddenly they become quiet, suddenly they become withdrawn, they become isolated, they don't want to play with others, then they are crying a lot, they are getting anger outbursts. You will also see it manifesting in their physical health. You'll see that that child is starting to get unkept. They are fighting with other children. So, and also issues like ADHD. You'll be able to see a child who is very jumpy, who is very interruptive in class. Very very hyper. They cannot settle. So those are some of the things that we are putting in that mental health guidelines, so that teachers, and even in Sunday school where the children are young, and even parents, educating them that when you see this, and if it goes on for a long time, it is good to see a practitioner, so that you can just get a clean bill of health. You can be told that maybe he'll outgrow it, but if it is a mental health problem that is developing, it can be handled early, because those are the ones that erupt into a full-blown mental illness. Yes.
Wow. So actually, that it's good that you have said that that there is a level. So you mean at some point, mental is not. First of all, mental is not just when we see people now they have gone naked,
Yes.
they are screaming,
Yes. Yeah.
and also at some point, it's not like the child is behaving funny because they are mentally sick.
Yeah.
It could be just something that can be worked on.
Yes.
Okay.
Yeah.
Now, going back to this toxic environment, now sometimes by nature, things do happen. That
Yes.
maybe this couple has fought and now they have to go separate ways. And you started by giving very definite roles. A mother does this, a father does this.
Yes.
What happens now when a father has been left or a mother has been left to take care of the child?
Yeah, so we said at the beginning that there is a whole list. Actually, there is an assessment tool for adverse childhood experiences. And one of the experiences that we call adverse, which affect the development of a child, is separation and divorce when it happens in the family. It doesn't matter who lives, but sometimes when the father walks away, this becomes a very disturbing environment for the children, because sometimes, depending on the age again, if they are young, they start blaming themselves. We must be very bad children, that is why our father left. We don't deserve his love. We must be, and especially when he goes, and after some time you hear that he has started another family, they lose self-esteem. They feel unprotected, because it's like the cover has been removed. It's like the fence has been removed. Of course, there will be issues of maybe lack of basic needs if the father was the provider. And I know it is true that there are some mothers who are able to provide all that the children need, but they are not able to step into the shoes of the father, because there is no woman who can become a father. And we always say that there is no woman who can turn a son into a man, because you cannot give what you don't have. So the children, they suffer what we call abandonment issues, neglect issues, and that now affects the kind of relationship that they form later in life. Because you see such a child, when the father leaves or the mother leaves, they feel like they don't deserve love from anyone. And so even when they form relationships later, they are very anxious. What if this one also leaves? What if he abandons me? And so they become very clingy, they become very dependent on the partner, and they become people pleasers, because I don't want to annoy this person, he might leave the same way my father left. So there are issues of codependence, there are issues of low self-esteem, there are issues of, fearing abandonment, and so the kind of relationship that they form, the kind of attachment that they form is what we call insecure relationships, or what we call avoidant relationship. You don't want to get very deep into the relationship, so that you can give this person the space in case they want to leave. You won't get so hurt.
Okay.
Yeah, so you get into what we call avoidant relationships.
Okay.
Yes.
Wow, I didn't know that. So sometimes the reason we refuse to to get so much attachment even to our partners,
Yes.
it goes way back.
Yes.
Probably from what we saw
Yes.
and what we lost.
Yes.
But now, Doctor, those homes maybe the unfortunate thing of maybe death has occurred.
Yeah.
And now we are left with one parent. What would you advise now so that this child will have a good way of growing up?
Okay. So actually what we are advising as mental health practitioners, not really advising, but maybe just suggesting, because you give suggestions and people
Implement.
yeah, people implement. Whether it's death, whether it's divorce, whether it is separation, it is good to be aware that these children need support to be able to navigate what has just happened, whether it's death, divorce, or separation, because the children need to be helped to go through what we call loss and grief. It's a process, and the last stage of that process is what we call acceptance. So even when it is about divorce or separation, these children must be taken through the motion, the stages, so that they come to that place where they are saying, well, this has happened, but life must go on. And they are able to understand the reasons that the divorce or the separation happened. It is the end of a relationship between my mom and my dad, but not between us and our father. So they need to be helped to negotiate those stages. When it comes to death, the same thing, because death and even divorce, you go through the same. From the anger, we start with anger. You are angry. Why has this happened to me? Why? Then you go to the second stage that we call guilt. Even when we are talking about death, guilt is where you start asking, oh, I wish I took this person to hospital early enough. Maybe I didn't support them, well enough. You go through that. And then the next stage is where you are now, negotiating with yourself, bargaining. Maybe I did what I needed to do. I did what I needed to do. Then there is a second stage of depression. Actually, depression comes at the point when you are now about to accept that this is what happened, because you are now facing the reality that this person has died, or this person has gone. And if you have good support, then you get to the last stage that we call acceptance. Okay, the person is gone, so we need to, to move on. Of course, with support. But the key word that we need to emphasize here is support, social support, to help the people go through those stages when someone has died, and especially a parent or a significant person. Because again, if this does not happen, you find people now become what we call professional mourners. Every person who dies, you find yourself there. You go there and you are crying even louder than the bereaved. What are you doing? You are dealing with your own loss through other people.
Okay.
Yeah. So people need to be helped to navigate those stages, so that they can deal with their issues. And even when they want to help other people, they help them from a point of knowledge.
Okay.
Yeah.
Do you think replacing very fast can help? Where we are thinking now that he has left and this child of mine needs a cover.
Yes.
I need to bring a man in here or a woman very fast to be the mother or the father of this child. But do you think a replacement is a way of helping the child?
Thank you for that question. And it is good that I have just mentioned about the stages of loss and grief.
Yes.
Because it will depend on at what point are you replacing. Are you replacing when people are still angry? Are you replacing when people are still bargaining? You see, now you interrupt the process. You interrupt the process. So what that means is that these people will not have gone through the healing process.
Okay.
Okay? And when that process is interrupted, it will manifest in other things. And that's why people are advised. I like to use this word with a lot of caution, because in mental health we don't advise. We just we inform, we share information,
Okay.
and then people are able to implement, you know, because it's case by case. But what is suggested in mental health is that allow yourself time to heal. Because if you go into another relationship when you have not gone through the process of healing, then it will take another turn. And this person will enter into a relationship with wounds that are still bleeding. Okay? And it means that you'll be splashing blood on the new partner.
True.
You know, from the wounds of the other relationship. So that's why we suggest about what is usually suggested is a period of like 2 years, you know, just to allow yourself time to heal, and so that you don't make decisions that are rash, and you may end up hurting even the children that have been left behind, and also yourself as a partner. Yes.
So parenting is such a serious thing that
Yes.
your life cannot be just your life.
Yes.
Whenever you are taking a decision, it has to be with your children.
Yes,
when
yes,
I do
yes.
this, how is it affecting my children?
Yes.
Okay. Now, Dr. There are children who are naturally, or rather, let me not say natural, maybe you will correct me by telling me whether it is natural. When you fight them, maybe a child in school is a bit aggressive, is a bit withdrawn, those signs that you have given us about maybe they are going through something at home.
Yes.
But then you realize like this child, it's kind of, you cannot mention, you cannot pinpoint anything. So are there issues that maybe are hereditary or biological when you realize that this one is a maladact, it's not the normal way of a child?
Yeah. Yes, and it is good you have asked that question, because sometimes when we face mental health issues, mental illnesses, sometimes we think it's a defect of character, you know, it's a moral issue, but it is true, like you have put it, there are issues that are hereditary. There are issues that are in the genetic makeup that we carry, you know, and most of the mental illnesses have a genetic loading. Bipolar, ADHD. You will find that when you identify a child with those kind of mental health challenges, when you do what you call a genogram is where you are looking at the family history. You may be able to find 1 or 2 people in the family who may be having the same problem. Even the addiction that we are dealing with here is also a hereditary issue. And that's why even when we are doing our assessments, we must also ask this question: is there anyone else in your family who suffers the same condition? And most of the times you will find, you know, 1 or 2 people. And so as you are putting it, it is correct that some of the issues are genetic.
Okay.
Yeah, even that, like I've mentioned, the ADHD, the bipolar, you know, depression, all those sometimes is about the genetic makeup that we carry. Yes.
And at the same time, you'd suggest, and we now get to the to the field and say, suggest
Yes.
that those kind of children, they need help.
Yes. They
can be treated. It can be, they can change. It is, I'm imagining something that is hereditary, something that is actually in your bones, like it's in your DNA.
Yes,
Can
yes.
it be reversed, or can it be managed in any way? And especially on children?
Yes. I like the word you have used, manage.
Okay.
Because actually, mental illness is, we manage mental illness. We don't cure. We don't cure, you manage.
Okay.
Because sometimes it is not a guarantee that someone will actually recover completely from it. But once you are aware of the condition that you carry, then you are taught how to manage.
Yes.
And so even such children who have that genetic makeup, the condition can be managed through what we call behavior modification.
Okay.
Behavior modification, so that you do psychoeducation, help the child understand that this is maybe not the child, you know, the caregivers,
Okay.
that this is the condition that this child has. It is called ADHD, or what we call hyperactivity. Just making the teachers aware, because sometimes the children who are being punished, who are being chased away from school they actually have a mental illness, and
Wow.
and teachers may not understand.
Wow.
Students who keep interrupting others in class, maybe they have ADHD, because ADHD is called attention deficit. It's attention deficit. They are not able to concentrate on something for long, so they keep disrupting. So that condition, some of those conditions can be corrected through behavior modification. You know, understanding that when this child behaves like this, then this is how we need to support him or her. And also being able to catch that when the behavior is about to erupt. You know, issues like anxiety. You know, you can catch anxiety before it erupts by just educating someone. How do you feel when you're about to have an anxiety attack? You feel like you're sweating, like you're shivering, like you're so unsettled. And so what do? You teach them about the grounding activities, where you can do, you know, breathing exercises, relaxation exercises, just so that the mind can settle and the anxiety can go down. So I'm saying this, I'm sharing this just to answer your question. That's about behavior modification, is about early identification, is about management. But of course, there are those conditions that have to be managed through medication. And that's why when a parent notices this behavior, it is good sometimes to check in with a psychiatrist or a mental health practitioner, just so that you can be assured whether it's a condition that just needs to be modified or that needs a bit of medication. Yeah.
Do you think what we are feeding our children on has anything to do with our mental health? Like we hear them telling us, kitambo we used to chew the banana for you to nakupea, but today we are doing Cerelac and all that. Do you think it has any effect on our children?
Yes, actually nutrition and mental health have a very strong correlation.
Okay.
Yeah, and that is why you will find that parents will be advised on the kind of food to give their children, balanced diet, ensuring that we go slow on the junk food, the oils, the chips and all that. Because one, the immunity of the child, if it is compromised, then it means that any condition that may be silent in the system of that child will be ignited. You know, we can live with a condition for the rest of our life, and it is not ignited because maybe we are living well, we are eating well, the atmosphere is okay. But if you already have that genetic condition, it will be fastened maybe by the way your immunity is, the environment in which you are living. And that's why then it becomes important to also ensure that even the nutrition of children is taken care of. And that is why you will find that when you have an autistic child, you can manage autism through medication, but also through diet. Just ensuring that you're not giving children, foods that will ignite their energies. And, because, an autistic child, they have a lot of energy, a lot of movements. So you have to ensure that the food that you're giving them is helping them to calm down, but not to ignite hyperactivity. Even ADHD, it can also be managed, yes, through medication if we get there, but also the diet must, because we understand that when you're hyper, what do you need to do? It is to calm down. And if you're hyper and then you're taking the sodas and the juices, and all, it doesn't demand rocket science to know what is going to do. Yeah, so as you have said, it is correct that nutrition and mental health have a strong relationship. Yeah.
Wow. Listening to Daktari, I'm feeling, or I'm realizing like there is what we normally say. Let me use Kiswahili. Mtoto akizaliwa anakuja na sahani yake.
Yes.
That allows us or give us a leeway of having as many children as possible, which is a blessing from God. Children are a blessing. But I feel like you're also pointing out like our what do we call it? Our economic status also can affect how our children are growing up.
Yes.
So you don't advocate having children who, when we have not planned on how we are able to bring them up.
Yes.
Okay.
Yeah.
Wow.
Yes.
Beautiful.
Yeah, it is true what you're saying. Yeah. Even growing up in a big family, a big family can also have an adverse effect on a child. And especially because a big family also means that the basic needs, sometimes the families are not able to meet the basic needs. So there will be suffering, there will be deprivation, there will be neglect, there will be abandonment, all those things that we have discussed before. They will happen in a family that is big, and especially when the parents are not very able to provide what is required for the children.
Okay.
Yeah.
Wow, beautiful. Now, Dr. As we come to the end of this, I think for me, I've taken a lot, and I have realized parenting is such a serious thing. So before you plan to start a family, ask yourself, are you in a position to provide all this? Because the moment you start realizing your child is giving some signs, then that makes you want to seek help. And of course, seeking help is not empty hearts.
Yes.
So definitely we need to plan ourselves on how we got that. Now there are those people who feel, and now I think nowadays it is gaining like people are appreciating it. Where I decide I don't want to get married, so I can get a child, whether I'm a lady or a man, because even men would maybe go for surrogate. So from the beginning, because what we have discussed is when we had father and mother in the house, and then something has happened, and they have gone, maybe separated or death has occurred. If I chose to be a mother and I will be the father of this child, do you think I'll be able to give this child the best, or I'll still need a father figure or a mother figure?
So thank you for that question, because I've met many single ladies who have everything to provide for their children, and they feel I don't need any man. But like I said before, you cannot give what you don't have. And it is said that no woman can turn a son into a man, because you have never been a man even for one day. So you can't teach another person to be a man. And that's why we encourage in mental health to have a mentor for a son of a single mom. Just someone who will walk with this young boy and teach him how to be a man. Teach him masculinity. Let him see how a man is supposed to behave. Let him teach him problem-solving skills, because you see, if it is only the mother who is working with the son, because we say monkey see, monkey do. So what is seeing the mother painting the nails and putting the makeup is what you learn. And remember, we say that when a child is in the formative years, it is like walking on wet cement. Everything you put on that mind will be implanted, and it will have to take an intervention to actually remove that blueprint. And so even for a young boy, they need a male mentor to work with them. It may be a relative, and of course a trusted one who will teach them the correct things. So it is advisable. Only a man can teach a boy how to become a man. Others will have CC boys, but who are more feminine than masculine. And yet at the end of the day, if a boy needs to be masculine, they need to offer solutions. They need to be problem solvers. They need to be the one who offer solutions, not running away from solutions. Men and women are different. Women will teach other girls how to become women, but only men can teach boys how to become men.
Is this the same thing with the girl child? Boy child.
No, because you asked about the boy child.
Is this the same as a girl child? Can I be brought up by my dad and be okay, or it won't be all right?
It is the same thing. The girl will need a female mentor also to be taught. Others will have a girl who is masculine and tomboys, tomboys and rough, and because I think God made us differently, and both genders need to play the roles that are assigned to them by nature.
And now I want you to give maybe a closing remarks, but before then I will ask, when now I'm already grown and I have realized such things that maybe I fear relationship, and it is because of what happened in my past, we are able to change what had been already put in our mind before when we were growing up. as adults, we can look for help.
Yes.
And it can be, because I'm asking that because just the other day, I had a lady confessing, and I want to believe she's a media personality. She must be almost my age to that is.
Yes.
She actually has already her own child, but she was saying the separation of the father and mother, up to date, it has still affected her life.
Yes.
Are we able to correct it?
Yes, we are able to correct it. Because, you know, in therapy, we talk about connecting dots. Connecting dots means looking back and identifying where did my problem begin. So when it comes to what we are calling adverse childhood experiences, and I have listed many of them, when a father leaves, when there is separation, when there is death, even when a member of the family has been jailed, even when someone disappears from the family, when there is neglect, abandonment. And we said neglect and abandonment doesn't have to be physical. You can have a mother or a father who is physically present but psychologically absent because of maybe other issues that are disturbing them, and so they are not bonding with the children. And we have talked about the environments where there is violence. So children grow up feeling abandoned, feeling unbonded, feeling unappreciated, all those things. And because we say that it is never too late to do the right thing, you may come to realize that the issues that have been causing you the struggles in life is about your upbringing. And you're coming to realize that at the age 40 or age 50. But we say it is never too late. Once you realize where the problem is, then you can correct it. But how can you correct it? Like someone asked in the Bible, can I go back to my mother's womb and be born again? And he said no. So even in therapy, we say you can't go back. But then you can do what we call reparenting. That is a reparenting exercise. That's a whole section that we teach in psychoeducation. So you are now coming to a place where you are accepting that this happened to me. I was neglected, I was abandoned, I was never appreciated, I was left, there was violence, I was beaten, I was abused. But now, do I have to go through life carrying these wounds for the rest of my life? How do you put a stop to that? Of course, it is not something that happens suddenly. It's a journey. We call it reparenting, where you are saying, now, I forgive all those who hurt me in the past. Maybe they did it out of ignorance, because there are times when parents hurt their children out of not knowing exactly what they need to do with the children. And maybe they also have their own mental health issues, and so they will abuse, they will neglect all those things. So you must come to a place where you are saying, okay, this is what happened. But you know what? Going forward, I am going to bring myself up again. I am going to reparent myself. So you are looking back and saying, as a child, what kind of parent would I have wanted to have? A parent who appreciates me, a parent who, who loves me, a parent who is present, a parent who gives me security, a parent who gives me affirmations. Okay, so then you say, then from today, I am becoming that parent to myself. Okay, so you start engaging in affirmations, like the same way you tell your child, oh, good boy. So when you do something good, instead of waiting for the world to appreciate you, you applaud yourself. You're saying, good job. You are also disciplining yourself the same way a parent would do. If you have a meeting and the meeting is supposed to start at 10, you're telling yourself, hey, Beatrice, you are going to get late. Wake up, and so that you don't get... The same way a parent would do to their child is what you're now giving yourself guidance, giving yourself reassurance, accepting yourself the way you are, and also, engaging in those self-affirmations. We call it reparenting. And one of the exercises that someone can do is to write a letter to your younger self. You write a letter that talks about all those things that you can remember, the things that happened to you when you're growing up. So you are addressing, dear Beatrice, and then you're saying, I acknowledge that this is what happened. It was painful, you were neglected. And then towards the end of the letter, you're saying, but you know what? From today, you have a new parent.
Wow.
And this parent is B. I will not allow anyone to hurt you. I will be there to defend you. And we can walk this journey together.
Wow.
Because when you don't do that and you have a wounded child inside you, they engage in what we call self-sabotage. And that's a big topic that we can maybe look for
It's
another
getting
topic.
deep.
It's getting deeper. Yeah. So when you have a child that is wounded, when you have not dealt with those wounds of the past, this child starts engaging in self-sabotage. So that, you know, self-sabotage is just spoiling things for yourselves. So you're getting into a relationship and you spoil that relationship by maybe you are refusing to keep calls, you are just you giving the silent treatment. But you know what this child is trying to do? So that that relationship ends and you go back to factory setting where you are neglected, you are abandoned.
Wow.
Because a wounded child learned from early that you don't deserve love.
Okay.
You don't deserve attention. So when those things start happening to you in future, the mind, the brain screams, danger, danger, and danger.
Wow.
Love is not for us.
Okay.
So self-sabotage. You get a good job, the wounded child says, this is not for us. As we are supposed to be living in those, you know, dingy places without this glamour is not for us. So you start going late, you start being rude in your place of work, and then you get fired. And the wounded child is saying, good,
Wow.
this is where we belong.
Wow.
That's why we advise or we suggest it is good to engage in parenting activities.
Wow.
When you give that assurance to the child and you enter into a no MOU that you have a new parent, no one is coming to hurt you again. You know what? That child now turns into your greatest fan.
Wow.
When you're getting a job, you saying, good, we deserve this. You see? Because now the child is assured that they have a new parent.
Wow.
No one is coming to hurt. So reparenting activities is how we can correct some of these issues that may have happened to us when we were growing up. It's a process.
Wow.
Yes.
Beautiful, guys. It's getting deeper when we are
Yes.
You know, even I'm seeing, even when I fail, like if I had an issue with parenting, when I fail, I should tell myself, you'll make it. You know, the way a parent will tell the child,
Yes.
you have failed, yes, but next time you'll do better.
Yes.
Wow, beautiful. You know, it goes with the same with the way the people, there's a meme that says, you're only an orphan up to, I think, the age 40.
Yes.
After that, don't tell us the reason you're not making it is because you're an orphan.
Yes.
So I think you're also telling us
Yeah.
you're only experiencing and suffering from childhood trauma up to a certain age.
Yes.
From there, you can get yourself a parent from yourself.
Yes.
Wow.
Yes.
I love that. Guys, haven't you learned? I love that. And that, I think that one can happen to all of us, even us who maybe we have come from a good family, there were no issues, but still there are some gaps that you feel you would have wanted to be supported in this. Like when we do, I hear every first certificate we take home, it's for the parent. Then now we start living.
Yes, yes.
I think all of us, we have an opportunity of telling ourselves, Susie, now you can do better in this one.
Yes.
Beautiful. That is so good. That is so wonderful. I think it is also happening. And unfortunately, I'm surprised and shocked of what I'm learning, that we can sabotage ourselves.
Yes.
That you can be having a good marriage.
Yes.
Is it the reason why sometimes we look at a person and we wonder, we thought this one is so good, why is she not able to appreciate what is here?
Yeah.
It's because sometimes there's something behind your mind.
Yes. It's because, like I have said, when we don't deal with the wounded child within. And when you talk about the wounded child, we are talking about all those experiences that we have enlisted. If you have not consciously, you know, dealt with them, then we view the world from our wounded self.
Okay.
Okay. And you know, today, if right now I decide to wear pink eyeglasses, everything here turns pink. If I wear green, everything turns green. And so when you're viewing the world from a wounded self, a good relationship looks bad.
Wow.
Someone who wants to form a relationship, someone who wants to love you, they look dangerous. You know, the mind is saying, no, it's dangerous to be loved because of the neglect, the abandonment. And then when you're in a relationship, you become suspicious. When your spouse is away, you're calling them, where are you? Because of abandonment issues. They are about to leave me, you know, always being anxious. And that's why I talked about the danger of the attachment styles that we form based on our childhood experiences. if you're forming a fearful or anxious attachment, then you'll keep your spouse on their toes, always having to explain where they are coming from, why they didn't pick your call, because you're anxious. You fear of abandonment. And this one, you end up spoiling, good relationships.
Yeah.
You will be in a in a job, like I said, and you're getting promoted, and now the wounded child is saying, hey, this is not for us. How will you handle? And so before you know it, you've started going late, you started being rude, you started being arrogant, and then you lose the job. It's self-sabotage.
Wow.
It's self-sabotage. And when we make people aware, you need to turn the child within into a fan, your greatest fan, who your cheerleader, who will be excited to see you progressing. But the wounded child will be unhappy to see you progressing. And that's what we call self-sabotage.
Wow.
So it becomes a very, very important exercise for someone, especially those who have gone through the trauma of childhood. Yes.
Wow, beautiful. I think, Doctor, we will look for you again. This one, we must hear it more. And we must get deeper into this. I hope you have captured. We have also learned about, we have been given marital counseling. Have you heard anything about marriage? If you are still on parenting, you are missing it. Rewind this video if you have not realized. There is somewhere we have been advised about marriage. Some of these issues happening, it has nothing to do with your partner. It has everything to do with yourself.
Yeah.
Well, Doctor, just because of time, I'll come to an end of this, but I feel that you really need to honor us and create some other time for us to talk things marriage now, because that is about parenting and coming up. I think there's deep things that we need to understand about marriage.
Yes.
Let me give you the opportunity to give your closing remark. Maybe you think there's something you want to talk to parents you have not mentioned.
Thank you. Thank you for this opportunity. And we've been talking to parents, and one thing that we are doing is a lot of psychoeducation and awareness creation, because one of the things that parents need to understand is that the way we bring up our children will have a very big impact on how they handle life later on. We say that you cannot prepare the world for your children, but you can prepare your children for the world. So we must be careful about the things that we do to the children when they are growing up. Always understanding that children in their formative years are like wet cement, that everything we do will be implanted in their brains. And that is the blueprint that they will use to handle the challenges that they face later in life. When we abandon our children, when we neglect our children, then we do not equip them with the psychological resources that they require to negotiate the challenges in life. As fathers and mothers, we need to give security to our children and assurance, so that even when they face challenges later in life, they have the strength and they can look back and say, it doesn't matter what challenge I'm facing, I have someone to fall back to. I have a mother, I have a father who loves me. That kind of assurance, that kind of strong background and foundation helps children to understand that, and also appreciate that it doesn't matter what happens to me. I will face the challenges head on, because in my hands and in my mind, I have the psychological resources that I require to face challenges. So we are saying, as parents need to really be careful to equip the children for the world. Let us give them security. Let us give them love, so that they don't start looking for love in the wrong places. One of the things we have realized is that issues of addiction and even mental health have a lot to do with the way we are bringing up our children. These adverse childhood experiences will either send our children to places where they are getting help, or they'll send them to places where their lives are being compromised. So if we support our children and we equip them with good psychological resources, then we are sure it doesn't matter, even when they go outside the country, they will have the strength and the assurance to know that they are capable of facing any challenges. Thank you.
Wow. Doctor, maybe you want to tell us where nobility is?
Yes, thank Thank you. So we are doing this interview at Nobility House Treatment and Rehabilitation Center. It is a rehabilitation center where we deal with issues of substance use disorders and also mental illness. And in this facility, we believe that mental health problems follow a certain path that is called biopsychosocial spiritual model. So some of the problems have to do with underlying issues, mental health issues that have to be treated with medication. Others have to do with psychological issues, and also others have to do with spiritual issues. And so the program that we run here follows that model. There are those who have to take medication, and that's why we work with psychiatrists. There are those who have psychological issues, and that is why we have psychologists. And we also have spiritual, what we call the walk of faith, just to reconnect people with the higher power. We deal with both males and females. This is a mental health institution at level 3B, meaning that it is a hospital registered by the medical board, NACADA and SHA, and also we work with other insurance companies. We deal with both males and females, and we admit those who have issues of substance use disorders and also mental illness. We are situated in Limuru sub-county, but our locality is called Ngesha. That is where we have the facility. And like I said, we engage in a program that treats, uses pharmacology, that is medication, and also counseling. We deal with issues of psychoeducation, where we educate even the families about the issues of addiction, so that when we discharge our patients, then they can get the support that they require from the families. We also deal with community engagement, where we are also informing the communities around here about the issues of addiction. And we also engage in a lot of outdoor activities, because one thing you learn is that mental illness teaches people to isolate themselves, to hide. And so treatment must also involve getting out. So we do a lot of outdoor activities to ensure that people are engaging in activities where they are releasing the energies, in a way that is helpful, instead of the activities that they were doing when they were in active addiction. So we have been in existence for the last 6 years, and by the grace of God, we have seen many people come out of addiction. And we know that addiction is recovery is a journey. It is not something that happens suddenly. So we say recovery is a journey in which you walk with others. So someone has to make the decision that I really want to quit, and then other people come and support. And as I finish, we say also that there is no recovery without discovery. So as we take people through this program, we also help them to discover the strengths that they possess, and also the support that they have not been using even in their journey of recovery. So as they discover those strengths and the resources that they require, then we release them to make use of those resources in their journey of recovery. Thank you.
Thank you, Daktari. We appreciate your time.
Thank you.
So guys, I hope you have watched, you have heard. Where you need to rewind, you can rewind and listen again and understand what you have been discussing about. And thank you so much for being here. Thank you for choosing Susie Ledadem. Thank you for choosing to listen to this specific video. If it has helped you, kindly share it with someone else so that also someone else can learn. What is your takeaway? For me, my takeaway, reparent yourself. We cannot keep saying our parents were toxic, they did this to us. What kind of a parent are you to yourself, not to your child, to yourself? I have learned a new thing today. I hope you have also learned something from the whole of this video. Please, on the comment section, let me know what have you learned, what is your takeaway from this whole video. For now, bye.